we already mentioned that some people may be especially vulnerable to the effects of THC in the amygdala, and then THC may induce anxiety and panic attack. This is particularly relevant because the cannabis that we consume nowadays is very high in THC. The cannabis that was outgrown 30 years ago had small percentages of THC. People have been creating hydroponic cannabis that is higher and higher in THC, and THC has been associated to bad, like side negative effects in terms of psychology. It's including anxiety, panic attacks, which start by fear and then over interpreting the physiological signs, such as like the tachycardia or some things you may feel in your body and interpret it as if you're going to die. And that's how the panic attack starts. And then because you're stressed about it, you feel more fear, you have more physiological activation, and it's a vicious cycle. There is some evidence as well of, and this is something you may have heard about and you may be interested in, like increase of psychotic symptoms, a psychotic episode. So this is a very complex interaction. It's not like a linear, you consume THC, you become psychotic. It depends on many things. It depends on your genetic risk, your genetic vulnerability. It depends on your psychosocial context and your particular mental health history. But it has been described that in people that smoke very frequently high THC cannabis and that have for genetic predisposition, like there's the risk of doing a psychotic break, it's 5 times higher than in normal population for high THC concentration. And as I said, depends on many factors, including genetic predisposition, psychosocial factors, but there's a 5-fold increase in the risk of an acute psychotic break. Just as a note, a psychotic break does not mean schizophrenia. Schizophrenia is a more complex disease. There are many causes of psychotic breaks, including using substances that include cannabis, and people can recover completely from a psychotic break, even though it's a very distressing experience. Then another of the acute risks, we already talked about the effect it has on the cerebellum and the motor systems of the brain. So you will be impaired if you use cannabis. You will be impaired from driving or other significant motor activities. Using cannabis increases the risk of automobile accidents 2 to 3-fold. For people that have respiratory problems, especially if they inhale smoke, that may worsen their asthma and cause heavy cough. In people with heart conditions, we mentioned that cannabinoids acted on the heart receptors, like causing tachycardia, so accelerating the heart rate. So people that have heart conditions may have an increased risk of a heart attack because, beating faster implies more effort for the heart. So people that have heart problems may be at risk of this, important to keep in mind. And as I said, fainting for people that already have blood pressure, because cannabis reduces blood pressure. And this risk is increased if you mix with alcohol. When we go to chronic risks, of course, for people that smoke, we will have an increased risk of developing chronic bronchitis and respiratory infection because of the constant irritation of the respiratory tract. There is also, as I mentioned, an increased risk of lung cancer that's smaller than the risk with tobacco, and that seems to go away if you stop smoking, but for chronic smokers, it is there. And something that's very important and relevant for youth is something called the amotivational syndrome. So amotivational syndrome is something that happens it's a psychological effect, neuropsychological effect of chronic cannabis use, in which, because we mentioned that cannabis acts on the reward system, it releases dopamine, and dopamine is related to pleasure and also to motivation to engage in certain behaviors. What happens is that in the long run, people stop being motivated for the activities that normally generated pleasure outside of cannabis. So people that smoke very often and high potency weed may end up falling in this state in which they don't feel motivated to do their normal activities. So they're, that's the classic stereotypical image of the person that uses cannabis and it's just there on the couch and doesn't want to get up and do their things. And they may need, the toke of cannabis or one hit of cannabis to become motivated to get their dopamine rolling again. So this is something that happens with other substances, but it happens with cannabis as well. And it's important to keep it in mind and to know that it happens for users and for people that know users, because this may require some type of cognitive behavior therapy, reducing the use and engaging in other activities that increase the release of dopamine, such as sports or social activities or stuff that the person used to like before, to avoid the withdrawal of these users from the activities that they were involved in before. For addiction, it has been said, and some people say that there's no addiction to cannabis, or there's no physical addiction, only psychological addiction. That's not true. There is a risk of addiction to cannabis. So far, the numbers say that 99% to 16% of users that started using cannabis during adolescence may develop an addiction. And that goes up for daily users. Daily users, 20 to 25% of daily users develop an addiction to cannabis. And another thing is that because there is a physical addiction, people that stop using cannabis get withdrawal symptoms. These withdrawal symptoms are, of course, not as bad as withdrawal of cocaine or withdrawal of heroin or other substances, but that's still there. These people will have trouble sleeping, will have dysregulated appetite, may feel anxiety or irritability after smoking, after stopping the use of cannabis when they have used it for a long time and they have already developed an addiction. And something that is also out there and it's worth revising is the idea of decreased cognitive abilities. Do people that smoke cannabis have in the long term impaired cognitive abilities, impaired working memory, impaired attention, impaired decrease in intellectual capacities? And the answer, once again, it has a lot of factors involved, but what has been seen is that while you were using cannabis, you have an impairment that may be bigger or smaller depending on the person, on working memory and attention, but this goes away when you stop using cannabis. Something that I did not mention is that both THC and CBD get stored in the body. So you use, and after you use, THC and CBD will be stored mostly in fat because they dissolve in fat. So in the fat tissue of your body, they will stay there. And depending on how much you were using and how much fat you have in your body, they can stay there up to 28 days. So while you still have this cannabinoid stored in your body, you will keep having some of this cognitive impairment of cognitive abilities. But studies have shown that if you stop after 20 days that you have stopped using cannabis, these impairments will go away and you will go back to your normal cognitive function, except if you had started smoking or using cannabis since a very young age and you're using high potency and very frequently. In that case, especially the ones that started at a young age, you may see some of these impairments stay for longer, like not be temporary, but maybe become like an issue further in time.